Hi everybody, Tasha here from Pixie Mommy's Reborns. Welcome back, and to everybody new, hello and welcome. I have here with me today baby Bear. Bear is a reborn baby doll, and he is the Ramsey sculpt. He's the sold out, highly sought after at this point, Ramsey sculpt by Cassie, and he was done by one of my absolute favorite reborn artists, and that is Tammy of Paper City Dolls. You can find Tammy and Paper City Dolls on Instagram. I will leave a link in the description below. So, oh, I gotta reach over here. I have a fox bottle, big bottle for him. Little Bear's gonna get a little bottle feeding, and I'm gonna chat about something, so I'm gonna get to it. If anybody of you have joined from the title, which I don't know, it usually just circulates within the reborn community, my videos, but just in case. I'm just gonna be doing a little bit of role playing here and just relaxing and chatting with you all. And this is something just so relaxing to do for any of you that, you know, are doll collectors and love reborn babies and the hobby. So those that have been with my channel, of course, you know, you all know me. Those of you, anybody that is new, I also well, since March, I haven't counted the months now, have been gotten into the art of, you know, painting the reborn dolls myself, which has just so far been such an amazing journey after, you know, 4 years or so of collecting. And, you know, I've always just had a deep appreciation for the art. So it's just been a very amazing journey for me. And I've created 7 babies so far. So that is super, super exciting. So I'm making a video for you all today because going in for some oral surgery tomorrow. That was originally scheduled, well, originally it was scheduled for August 26th. And I unfortunately got bumped out of the appointment. My oral surgeon had, like, I guess, some emergencies that backed up and whatever, and I got put in for this Thursday, which I believe is the 16th. So I'm in quite a bit of pain. I'll explain that and what's going on in my mouth in a minute. I had called this morning and they happened to get a cancellation, so they put me in for 9 a.m. tomorrow morning or Tuesday morning. So I will be in for, you know, oral surgery tomorrow morning at that time. So those, all my prayer warriors out there, prayers are greatly appreciated. So let me tell you all a little bit about what's going on and the anxiety that I have about the dentist and oral surgery and stuff, and what I've been doing to help myself with that and coping with that, and how I actually will get through the oral surgery as well. So before I get started on that little story, don't forget to go now, smash that subscribe button if you'd like, and hit the notification bell so that you never miss a video. All right, so those of you that, I know I'm focused on Bear right now, but those of you that know what I look like and when I'm talking and stuff, you know, my front teeth, I've got, you know, one cracked, and I that's one of my real teeth, and I do have dentures, and there's now like a space kind of between them. So, you know, my teeth are not perfect. It's embarrassing. It actually is. And now, and you know, the past few years being a YouTuber as well, it's like, it's the first thing you want to run and go fix when your face is in front of the camera. That's, you know, the rational thoughts, of course, right? And of course, you know, you're on YouTube, you're putting yourself out there. There's always gonna be people out there that, you know, are unkind, that pick you apart, anything about your looks. Folks, let me just go there, for a second. You know, making fun of people's looks, whether you think like it's a tooth thing, and I've seen comments, not constantly, but I've seen comments, like, go get your, why don't you fix your teeth already, things like that. And it is hurtful, I can say that, because yeah, of course it is. um and to you may think it's something as easy as that, like, oh, why don't you go get that ugly mole removed off your face already, like it's a cosmetic thing and somebody can go and have it fixed, which may be true, but you don't know someone's circumstances. Someone may have a mole that can't be removed, or they have an immune issue, or other serious health issues, and that's the last thing on their list. You have no idea what is going on. So try to be, we're all beautiful in our own right as human beings. And if you don't have something nice to say, try not saying anything at all. I mean, why, what, anyway. But that being said, I have, I've always, originally, for most of my life, I was always pretty okay. I've had a lot of teeth removed. I've had a lot of work done in my mouth, and I did have everything fixed at a certain point, and I had the upper partial dentures on the top, and kind of had all my teeth, and felt great. But then more started to go. I am an alcoholic and an addict in recovery. I am sober since 2007. I do believe that a lot of my dental issues have come from the prior years of abuse to my body, and letting things go, and kind of eventually all my teeth will probably go. Even the dentist has told me that. But so when things started to go haywire again, I don't know what was going on in my life at that time, about, I don't know, 8 years ago or so. I'm not even 100% sure, but I had let a tooth go that got to the point where I was in a lot of pain. I'm sure many of you have experienced that, where the nerve is exposed, and you all know you wouldn't wish that kind of dental pain on your worst enemy. And my oral surgeon that had previously did a lot of the work and stuff, whom I really love. He's a very seasoned, he's a specialist, he's just amazing. He's very compassionate, and very competent, and just you don't even, like, he gives you those shots where, like, you barely even feel it. Like, he just knows how to jiggle your mouth and where to go. And I mean, of course you feel it, but you know what I'm saying. Anyhow, that oral surgeon stopped taking my insurance. I was in an emergency situation. I had an exposed nerve. I was in a ton of pain. I went to my dentist, and I had to go to where the dentist referred me, or pick a place, but I went to where he referred me. That wasn't too far from me, like a town over, to an oral surgeon that I had never been to. I'm not going to get into too much detail. I'm just going to say I'm one tough cookie. I never had a problem with the dentist. I always opened my mouth wide, took the shot, took whatever, my whole life. Just, children's chair, it is what it is. As of late years, when my spine went, it actually felt good to be laid back in that chair, and I was like, it's decompressing my spine, and it was like a 15-20 minute break from life and reality, and I could put my feet up, and I just ignored the pain and whatever was going on, and just fine, just chill. I'm a chill person. This experience was so horrific. This surgeon, while I was awake, literally sawed into my jaw. I have a whole hole in my upper jaw. Um, just, I mean, obviously you don't know, maybe perhaps something's going to be that intense until you get in. My teeth come out very, very hard. They're very, my roots are very long and very thick and very anchored into my jaw. It's just my anatomy. So, and I felt like my eyeballs were going to pop out of my head, and I could feel my blood pressure very high, and I do have high blood pressure. So I actually really started getting worried that I was going to stroke out on the table. He refused to give me sweet air, which would have greatly helped, that just, yeah, I mean, I've been in this situation in my oral surgeons, and you have to pay for it. How my insurance is set up, they don't cover it. You have to pay for it, which I was like, my credit card's in my pocketbook on the floor. Like, didn't care about that. But for whatever the reason, and I do always give the doctors my history, when I'm coming in. And, unfortunately, as an addict, alcoholic, in life, I've have at one time or another, experienced, unfair, treatment at healthcare because of that. But I'm not going to give my history. And of course, anybody I'm going to, any doctor, whatever that I'm going to for something specifically dealing with like pain, I want them to know, don't prescribe me anything. Don't let me walk out of here with a prescription for painkillers, because, and you want them to have that on record, because I may be, saying that now, and next time, for whatever the reason, you just want to protect yourself. You want to always know, you want your doctor to know what medications you're on, et cetera, in your history. And, you get the occasion where the bedside manner changes after they hear that, and it's like, oh fuck, I really, excuse my language, oh, I'm so sorry. But it's like, oh, I just wish I didn't tell this doctor. But that was one of the cases here. So it was extremely traumatizing. They worked on my mouth well past closing time. So not only was the whole experience horrible, and I couldn't just get up in the middle of it once he had my jaw open. I had no choice but to get through it and let him finish. And even leaving, his staff was now in a rush, and he was in a rush to leave because it was well past 5 o'clock. This obviously took way longer than expected, which of course wasn't the patient's fault, wasn't my fault. And they literally just like closed up and just like are leading me out the door. Like, they didn't even give me, I was in the car shaking, crying. They were like walking past, getting in their cars, because it was like the office was in like a little shopping center. They could see me. I was not okay. I was panicked. Nobody even waited till I was calmed down enough to get in my car. No less has the bleeding stopped, has this, that, or the other thing. It was just the most horrific thing. I drove home. I know I drove over curbs. I got on the phone with my husband, crying, panicking, going over curbs. And it was only like a 7 or 8 minute drive, but thank God. And thank God I didn't get into an accident. I pulled in the driveway crooked. I called my husband when I got close, come outside. I just like fell out of the car, shaking, crying. Got all this cotton in my mouth. Couldn't even really explain what had happened. It was that awful, folks. It was that awful. Since then, I have a tremendous fear. My oral surgeon now, the one that I love, years later, and obviously as of right now, is taking my insurance again. So, which I'm super, super grateful. And I have already been back and had one tooth removed, which you all that have been with my channel probably remember that hot mess. Because now what I do is I just assume let my teeth rot out of my face than have to deal with the dentist. So the two upper in the back, or three, they're telling me it's three. I thought it was two because they're down to the gum line. I let the teeth go. The nerve got exposed. I was taking cotton balls, clove oil, shoving it up there, survived the nerve dying on these giant molars, only to wind up at the end. I guess there is still some nerve in there, and then probably infection, which of course I've been on antibiotics, which worked when I first took them when I went in the beginning of the summer. And when they had to reschedule me, I had to tell them I'm in pain again, and they called in more antibiotics. And in the meantime, another tooth on the bottom, which was about in half, I had said to my dentist to put on the referral because I knew that one was going to go next. So I'm like, I'm going to be there. I'm going to be getting it done anyway. At least let me prevent myself from going in pain in this one. And, lo and behold, because it got rescheduled, I landed up where now it got down to the nerve. And so you all know what tooth nerve pain feels like. And when it's constant every day. So you're like, well, why are you making a video? You're talking, you sound fine now. And I do, because I'm taking a boatload of ibuprofen, some nerve medicine that, I normally take for my back, and Tylenol in between. And I'm all right for a couple hours after I take something. It's like I feel it, but I'm not like on the floor, but then when it starts to wear off, before I could take another dose, and I literally have a pad and written down when I've taken what, and as well as the antibiotic, because I don't want to overdose myself on Tylenol and ibuprofen. It's because when you're in pain, you're automatically like, let me go take something, it must have been worn off. Well, I want to make sure I don't take too close together, because I'm just, so every 4 hours on the Tylenol, every 6 to maybe 8 hours on the ibuprofen, 800 milligrams of ibuprofen. I know, ladies and gents, I know it's a lot, but I can't take pain medication. Obviously, I'm an addict. I cannot, under any circumstances, take any sort of narcotics. So this is it. Plus, it doesn't, I've been in that situation years ago, and honestly, the ibuprofen and the Tylenol works a lot better, folks. Just saying. All right, so that's the deal, Smearls. So what have I been doing now, and why I figured I would talk to you all? And number one, it'll probably, it's going to be a little bit probably before I can talk and make a video. So I will be missing you all. So I'll be coming to this video and hopefully being able to at least chat with you all in the comments for the next few days. I love for your prayers or positive thoughts and energy and vibes and all of that. Much appreciated. I very much believe in the power of prayer. And yeah, so that would be wonderful. So I found last time I did go in for the oral surgery. He's a cloth body baby, by the way. There's no anatomy here. It's just cloth body. I think it dawned on me in the office right before they, started to work on me to take the tooth out that I went for last time, which that was just an extraction. It was so badly infected that the emergency room couldn't get it numb. It was horrid. And they were like, they shot and they actually went and got like a different kind of anesthesia that they use and shot it directly into the pulp, because the tooth was open. Oh man, don't even want to go there. Anyhow, because I enjoy the guided meditation, I like to listen to it at night. I have my favorites. I enjoy meditating very much. I enjoy falling asleep to ones that I like, I said to myself, you know what? That will be perfect. I asked my oral surgeon, is it okay if I put on, and he said, oh yeah, that's a great idea. Absolutely, go for it. He's like, as long as you can hear us. And I said, well, yes, I can put one, I'll leave one headphone in. That's what I do when I'm sleeping at home anyway, because I need an ear open to hear from my kids and things like that. Anyway, so I'm used to that. So that worked out perfect. I don't know what I quickly looked up on YouTube, because I did type in something about dental guided meditation through dental procedure. I don't even know what I typed, and I don't even know, because I had to get something up quickly. And that's what I did, and I have no idea what it was. It was a decent one. It had good music, and whoever was talking, I listened to the voice, and it worked well. It worked pretty well. Now, of course, with all this, and this is major work that he's got to go into my gum, into my jaw, and it's like either 3 or 4 big teeth. It's top and bottom. I got quite a bit of anxiety, and I'm prone to complications afterwards, like mostly like dry socket, and just a lot of pain and healing. By the way, the one that I had with the oral surgeon that had horrible bedside and was just unhumanly unkind, he did put me back together and stitch me up, and I will say I was so traumatized. I came home, I took something to knock myself out, packed my jaw in ice, and basically laid there in a dark room for 2 days, just rotating the ice on and off my jaw, because I knew what happened. It was so major that I was just so scared, and I just wanted to keep calm. I was just so, every time I thought about it, I just was like in a panic, and I'm like, this is not going to help me heal. So after 2 days of the ice and stuff, and then just taking care of it and stuff, he did do a good job that way, and it healed fine. I didn't actually have any complications or problems with that one. But as far as his bedside manner and the trauma, I mean, literally trauma and PTSD, I'm not joking. Like, and I'm not a complainer. I'm not a person that, you know what I'm saying? And I never had anxiety has never been like an issue for me. I have other issues. I have ADHD and alcoholism, addiction. Like, I'm really far from perfect. Anxiety has never been high up there on my list of things that, were, that I experienced much of in my life. But, I'm having a lot of anxiety. So now what I have done is, in advance, in looking up, because I figured, let me look up and set up what I want to listen to this time, instead of just randomly, and I don't even know which one it was that I put on to go back to that one. I'm finding, guided meditation, hypnosis videos, discussions and things to relieve your anxiety about going to the dentist, that they recommend that you listen to, several times before going. And it's certainly, if I'm thinking about it too much, I will sit down, put something on. I kind of just started that, like, now, like this morning when I found out I'm going in tomorrow morning. So I will maybe on my community wall, once the surgery's over and stuff, I will put up the links to what I felt worked good, for prior to, and then what I will put up whatever I decided to listen to during. And I am just dressing Little Bear. He had the little blueberry shirt on by Quincy Mae, and I'm now adding the little ocean color pants, the bonnet, and oh, the booties. I'll probably want to put the cream booties to offset. So, I'll put these on for now. They're right here. So anyway, and of course, there's nothing more relaxing and calm than to holding, one of these babies. The weight of them feels like a real baby. They smell like a real baby. They look like a real baby. And if you're a baby person, just relaxing and, holding a reborn and, just rocking them or sitting like I did and, pretend to, role play. And, it's just a relaxing, calming, thing. So, I know that the guided meditation will help me the most, tomorrow, during the procedure, the surgery. It's not procedure. It's a surgery. It's not a tooth pulled. It's surgery. There's a lot of work getting done, which I know. I'm sure many of you know and have been through, and I hope you all have had, even though nobody loves to go to the get oral surgery done or even go to the dentist. I hope no one else has been traumatized by a surgeon with, that poor bedside manner or, really unethical. It just, and people have said to me, you could sue, you could this, I'm not, no, thank you. That's just not for me. I just have too much going on in life than to take something up like that. And, I would literally have to be going and seeing a therapist for it, to have a paper trail to even consider that, because medically, it healed up fine. So what are you going to do? It was his bedside manner and his, as a human being, as a person, just not very compassionate, nor was his staff. Which figures, but anyway, where I'm going tomorrow, they have a wonderful staff. I love them all there, and I love my oral surgeon. I just wish I never had to see him again. If that makes sense. So yeah, that's what I'm doing. I'm gonna let you all know on my community wall. I will update everyone as soon as I can. It'll probably be more so in a post on my community wall, so make sure you're subscribed and hit the notification bell, so you'll get notifications if I post on my community wall. I will let everybody know how I'm doing at a certain point. I will, of course, appreciate all your prayers and thoughts. Please don't forget to give this video a thumbs up if you did enjoy it. Also, check out my channel's exclusive membership. If you would like to support my channel and come behind the scenes with me, become a member. I'm sharing all of the, journey in my art and, collecting. I do most of my live streams in there and membership, and there's lots of content in there. So if you'd like to check that out, there's always, you can click the blue join button right next to subscribe, or if you don't see that, because some devices you can't see it, in the description of the video down below, there's always a link. And if you want to see this little cutie and all the babies in my collection, there's always a link to follow me on Instagram as well. I post a lot of photos on there and share my favorite outfits and new outfits and things like that. So lots of fun on there too. And I hope to see you all back here, that I'm back here real soon. And the upside to all of this, and to all of you that are still here listening and care to know, I needed the back teeth, the teeth that are bad, out before I can venture to get the front teeth fixed, to get a mold, a partial done, the things that they do, apart from, I guess, paying for veneers for some of the front teeth. But you wouldn't want to do that when at some point they've got to go in and be yanking teeth out of your mouth because they could get broken, or you need to take care of things in a certain order. And those of you that have had your teeth fixed, that. And this is the first step. Well, I'm kind of forced into it because of the pain. I didn't make it to just let the teeth run out of my mouth. That was my plan. Seriously, you all, it actually was my plan. I'm like, I'd rather just die. I'd rather have my teeth run out of my mouth. I'd rather anything. It's the one thing that I fear and I have anxiety over. So I hope that makes sense to you all, and now you all know why I haven't just run and fixed my smile, so to speak. I would love to have that. I would love to confidently have a beautiful, nice, white teeth smile for you all. And hopefully now one day I'll have that, because I'm all right going to the dentist to get other things done. It's just a matter of the surgery. Well, I'm not so all right. I gotta say, I avoid it. That's what I'm saying. So, but I will follow through, because once the hard part is done, I then can go in and go through the process of figuring out whether it's going to be veneers or a new partial, whatever it is. But I really look forward to the day that, I have my teeth, a nice smile for you all and my teeth fixed. But that's been my journey thus far. Thanks for sticking with me and my story and my channel, and love to all of you. God bless.